livestock production is essential for good nutrition and possibly also good health outcomes. And there could be several pathways, but main one directly is that just what Keith has been talking about, that when you produce something, then you certainly would have a share of it, but also indirectly in such a way that you could sell the products and then buy perhaps more nutritious food or more quantities of food. And there's been some work in that area, but the nutritional effects, especially on stunting, are a little bit modest. They are not very convincing, but at least there is something in that direction. And most of the studies that are there are mentioning one key thing, that they don't have enough, there are always data limitations. So that gap can definitely be filled by our work going forward. So the data that I'm talking about is from 4 districts in the north of Uganda and 2 districts in the southwestern part of the country. And we have about more than 7,000 children below 5 years that are within 3,600 households over the 2 data waves. What is special about our data set is that we don't, say for instance, measure malaria by recall, but we actually take blood samples and we test for malaria as well as hemoglobin. Yes, and so just taking you through the results that we have done. So the first set of analysis is basically looking at whether there is an association between livestock, and here I mean cows, cattle production, and malaria. And when you use several methods, I don't have a pointer here, but if you have a full, probably, looking at the data set for both waves of 2012 and 2014, as well as also take some care of endogeneity, so the confoundedness. And then you also look at some form of fixed effect analysis, and then do that as well with the control function, so taking care of some factors that could confound the results. You really find a consistent effect or association between owning livestock and malaria. And so this is roughly in the range of 12 to 14%, so meaning that children living in households which have livestock are likely to have 12 to 14% more, have 12 to 14 more chances of having malaria. And so definitely these are the the individual and child level attributes, as well as the mother attributes and the household. So the 50% is basically included, as well as the 25 from Jerry's presentation. Then there are some key things that are coming out and hypotheses that have been, from the people that we've been discussing with, that have been suggested. One of them is that households which rear livestock tend to have a specific activity pattern. So maybe they wake up so early in the morning to tend to animals, as well as also doing milking and taking the cows back to the kraal or the pens late in the evening. So for that, then they are more exposed to mosquito bites than perhaps those households which don't have livestock. The second one is that cattle hooves, as well as drinking containers, are likely to be breeding grounds for mosquitoes. So if they're around the household, then perhaps would have children living there more exposed to malaria than. And for me, which I think is my best bet, is that there are some mosquito bites, some mosquito species which thrive on both animals and humans. And I think that's some idea that we got from when we had discussions with some entomologists who are also working with USAID. So these are areas that we need to sort of try to do more teasing out, so that we can be able to inform future program targeting, especially as far as malaria is concerned. So the second part that I try to analyze here, and this is work that is still ongoing and it's not yet published, but we already see that anemia prevalences are high in Uganda, and it's always worse for kids who are below 2 years. So it's basically more than 40%. So you're talking almost like half of the children below 5, more or less like anemic. And when you look at the data and you do some simple correlations, you see that we observe that children who are younger and living in households which, or rather have malaria, then have 23% more chances of being anemic. So malaria and anemia are quite closely linked. So, going really fast over this is that we do the same analysis, but then now we are looking more at anemia and the factors that are driving anemia. And what you see, basically taking all the other conditions that I also took for the case of, malaria outcomes, you see that first and foremost, if I start from down, is that yes, in the first two regressions, household ownership of cows or cattle tends to reduce anemia by about 9%. Okay, but then if you include in several other variables and you control for fixed effects, then this basically ceases to be not to be the case. But what is consistent is testing positive for malaria and the relationship between that and anemia. And so it is roughly something like 74% going upwards. So the message here is, well, we could have animals that are good for nutrition as well as, but then there could be some other factors that are related to that, and you need to really have a holistic approach to doing all these things, especially in research as well as programming. So I'm doing this very fast, and let me hope that we will have more questions and perhaps some discussions at the end of this story. So the key message is that going down interventions promoting livestock production would achieve better nutrition outcomes, for instance, reducing anemia, but if other health confounders, for instance, control of mosquitoes, are seriously given consideration. So, as I said, this is more or less the study that is rigorously, in a way, analyzing the association between livestock ownership and anemia, as well as malaria, but then we can always do better, of course, when beyond this. So there's not been something like this that has been done. So I think we will have, to look at this in a different way, looking at the income levels or the wealth quantiles and several other factors that would be important, as well as also making a differentiation between the child. Okay, so are the effects more felt for children who are above 2, maybe between 2 and 5, or those who are below 2 years? So these are, thank you so much for listening.